Hello.
Want to take a moment and remind everybody that this will be recorded. The folks helping me record tonight, please make sure you press record. Dr. Aguilera-Fort,
Thank you.
you may start, please.
Thank you. Hello, everyone. Good evening. Carlin Aguilera Fort, and I have the honor of welcoming you today. I'm the superintendent of schools of the Oxnard School District, and it is mine and our pleasure to welcome each one of you. Today, we are hosting this webinar for parents with the goal of providing you with as much information as possible based on what we currently know and based on the information that we have received from the public health department as well. So today, the session, as Dr. Shea has stated, will be recorded, and this session also will be translated into two additional languages, Spanish and Mixteco. So if you need interpretation in Spanish and or Mixteco, you have the little globe, the icon here, and that's the one that you will click, and you will select the language of your preference. If you need interpretation in Mixteco, you will select Portuguese because the system doesn't have yet Mixteco as an option. So we are using Portuguese, and that will take you to the Mixteco translation. And if you have any doubt, if you need any help, there is the phone number that you can actually dial, 213-640-9026, so you can be helped. Our intent today is to share with you some of the work and some of the processes that we have in place for when we come back to in-person instruction. That date has not been determined yet. And as you know, right now, the Ventura County, based on the system that tracks the cases of COVID, we are in purple. And that is the most restrictive situation for any county. And that means that many business organizations cannot be functioning at full capacity. For us as a school district, means that we are not able to open the schools for in-person learning, meaning our students will not be able to be in our sites, in our classrooms yet. We hope that once we get into the red tier, which is a little bit less restrictive, it's still restrictive, but not as much as the purple, we can plan the return. We have received several questions from you, and we know that you are waiting to hear some details that can help you to make a decision about sending your child back to school. I want to share with you that we have some of that information, and still some of that is not ready yet. Part of the information will depend also on you completing the survey that we have sent home. And as challenging as that can be, we are asking you to please fill out the survey if you have not done it yet, thinking what will be the best for your child, knowing what you know right now, and hopefully with the information that you will get today, you will be and you will feel more ready to complete the survey. If we have time, we will be able to address some of your questions. We are not having a dialogue, an interactive session. You will be able to write your questions, and we have members of the team that will be responding as you ask the questions in writing. Those questions that we are not able to answer today, I assure you that we will respond by collecting them and then having those responses posted on our website. I also want to tell you that we have several members of the Oxnard School District team here, and each one of them will be sharing with you part of the work. The reason we are asking each one of these members of the team to do so is because they will be sharing their area of expertise. They are the ones leading the work in each one of those areas, from education to facilities to risk management to social emotional, all of those areas we are trying to address today. And you have the team here that will be sharing that information with you. So without further ado, again, thank you for being here. We hope this is informative for you, and we hope to continue having these interactions. So I would like to invite Ms. Norma Magaña, our Director of Risk Management, and she will be sharing with you some of the health and safety protocols. Ms. Magaña.
Good evening, everyone. Good evening, everyone. My name is Norma Magaña, and I'm the risk manager here for the district. And I want to go over all of our health and safety protocols that we have put in place for our staff and our students. We take safety very serious here at our district, and we are very concerned ensuring that we have a safe environment for all. We have put in measures for social distancing. We have distributed supplies and protective equipment to all of our staff, and we are getting ready for our students when they return. We're going to have all our supplies ready and available for them. We have mandatory face coverings. Employees were required to do the COVID-19 online training that was mandated through the California Department of Public Health. We follow all California Department of Public Health guidelines to ensure that our cleaning and disinfection and ventilation are up to par. We work really hard on making sure that our custodial staff comes in and touches all the surfaces that are touched quite frequently. We're doing that quite frequently throughout the day, and Mr. Miller will go into more detail with that later on in our presentation. We encourage frequent hand washing. We have hand sanitizer set up throughout the schools and throughout the district to ensure that we're doing our hand sanitizing and our hand washing. And we also encourage and put in protocols to limit sharing between individuals. Next slide, please. So let me go into a little deeper on what has been set up at each one of our schools. We have done assessments with facilities to ensure that plexiglass partitions have been installed to ensure that all of our staff and students will be 6 feet social distancing. We're going to be installing directional arrows to ensure that there is minimal crossing between individuals. We have message signs and floor decals. We're going to have those all throughout the school to really remind our students and staff on social distancing, the importance of it. We're also going to be having employees, they will be required to wear the face shields, the face masks, and also students will be required to wear the face coverings as well. Next slide. Schools will be provided with hand washing supplies. We have those throughout the facilities. Hand sanitizers are available at all of our check-in stations, as well as hand sanitizers in all of our classrooms, as well as our face coverings, and multiple personal protective equipment will be distributed through all of our schools. We will have touchless thermometers available to do temperature checks. Those will be available on a self-check-in basis with our staff. Cleaning and disinfecting supplies will be in every room. We will have gloves, we'll have masks available. We will ask students if they would like to bring their own masks. Feel free to do that as well. We'll have N95 respirators available for staff that are required to wear those if they're working in specific areas that we do have a requirement for the N95 masks. Next slide. We created a COVID-19 parent training that is available on our website. Feel free, we invite our parents to visit our website. It's on our main page, you click on the COVID link and it takes you to resources, and then it's in English and Spanish. And it's available to share, and you can watch it as a family, and you can also share it with your students and your children, and also so that it's a great reminder when students come back to school that they follow all the protocols required. Next slide.
Good evening. I'm Anna Thomas, Director of Curriculum, Instruction, and Accountability for the school district. For arrival to school, a face covering will be required. A social distance of 6 feet must be maintained at all times. Each site will have multiple points of entrance. School plans will identify arrival and dismissal areas and will be shared prior to the return of school. The flow of traffic has also been marked at sites. No visitors, parents, or guardians will be allowed on campus, and no one will be allowed on campus if they have a temperature above 99.5 degrees. There will be more information on state preschool provided to those parents because some of the requirements are slightly different for preschool students. Next slide, please.
As we know, our mask requirements change quite frequently. Currently in place for mask requirements are that all individuals should be wearing a mask. Staff and students are required to wear a mask. Indoors and outdoors, the only exception is if you're at home, you don't have to wear a mask, or if you're in your vehicle and you're one per passenger in the vehicle, you don't have to wear a mask. In addition, there are some exceptions. If you have a specialized healthcare diagnosis, you don't have to wear a mask, and we will have some more information and forms that will be required if your student does meet that criteria. While you're waiting to enter into campus, students will be required to wear a mask at all times, with the exception of eating and drinking. While they're entering and exiting schools, they'll be required to wear a mask. While they're waiting for buses, they'll also be required, and a doctor's note will be required if there is a medical reason why your child cannot wear a mask. Next slide. Requirements on masks. There's multiple types of masks, as you know. The approved masks are the disposable masks that you see throughout the county. Students can wear the cloth face covering masks. We ask that masks have a 2 to 3 layer if they're using the cloth type. Also, the mask should go over your nose and over the mouth and should go under the chin. I know some individuals, sometimes they like to pull the masks down. If you need to pull it down briefly to get some air, that's fine, but you need to put it back up. The mask ties should go around the ears, the loops around the ears, and should fit snug around your face. Gaiters are allowed if they have 2 layers. Next slide.
Just a reminder about questions. If time permits, we will address questions at the end. You may enter questions into the Q&A over the course of the presentation. We will not call on raised hands. Please use the Q&A feature. We are taking notes and will work to create a list of frequently asked questions to be published at a later date.
Para interpretación al español, localice el globo en la parte baja de su pantalla y seleccione español. Para interpretación al mixteco, por favor seleccione portugués. Si tiene alguna pregunta, por favor llame al 213-640-9026.
Classrooms will have assigned seating, desks spaced with floor markers, a flow of traffic marked, clear sneeze guards on desks, material boxes for each student, a limited sharing of resources, excess furniture removed, access to washing and/or sanitizing of hands, The rooms will be cleaned daily, and the rooms will be configured for approximately 12 to 14 students. Next slide.
Knowing when to stay home and self-isolate. So as we know, our numbers are a little risen here in Oxnard, and we do have some COVID exposures that we handle on a daily basis. So as a reminder, we want to share with you, if your student or staff member tests positive or has symptoms, we ask that you stay home. You self-isolate until the following three criteria are met: 3 days with no fever, symptoms have improved, and 10 days since symptoms first appeared. Second scenario would be if you had close contact, if you were identified as a close contact, meaning you were near a person for more than 15 minutes within 6 feet, you would be considered a close contact. If you were close to that person that was positive or is having symptoms or is in the process of being tested, we ask that you stay home and not come to school. You self-isolate for 14 days. You self-monitor the student's symptoms, and you follow the CDC guidance. So 14 days in isolation, in quarantine, to ensure that there is no possible transmission or contact with someone else. If you have been in close contact with the person who's been in close contact to a person who's tested positive, it is okay to send, and you have no symptoms, student doesn't have any symptoms and is not currently being tested, it is okay to continue to return to work or school. Next slide.
Just as a note here, this slide is being interpreted for our Spanish listeners. We will move to the next slide in just a minute.
Thank you. Reporting COVID-19 absences. If your student or staff have tested positive or been exposed to a person who was positive, we ask once again they stay home and they quarantine, and also contact the school, report the absence to the main school line. Next slide. What happens when someone's sick? We do follow the Ventura County Public Health school symptoms decision tree. So if we have someone who, there's two categories. There's low risk and there's high risk. Low risk is anyone who has a fever, who has a runny nose, congestion, nauseous, vomiting, sore throat, headache, or fatigue, muscle ache. High risk would be someone who has cough, difficulty breathing, or has loss of taste or smell. That would be considered our category, a high risk category. So we do follow the decision tree. We ask that we do report the illness, to the school. At school, if we have a student that does develop symptoms throughout the day, maybe in the morning when parents take their temperature and they don't have a fever, but maybe at school, they get to school and then they develop some symptoms, we will have a care room designated specifically to take our students there, and then we can call parents and ask the student to get picked up. We will call home. We'll ask that the student quarantine. We'll also cleanse the area. We'll cleanse and disinfect the room to ensure that there is no further transfer of any COVID symptoms. We'll do contact tracing to ensure if there was anybody else that could have possibly been exposed, and we'll also put them in quarantine for 14 days, or if necessary, we may close the classroom. We'll contact Ventura County Public Health to notify them so that they can also, in addition, follow up and track the person who does have the symptoms to ensure that medical attention is being provided and provide any guidance on a daily basis to those individuals. Families will be notified. In addition, if there is a student that becomes with symptoms in the classroom, parents will be notified, staff will be notified that there is a possible potential positive case, and we will do that through the Parent Link Connect Ed call. Next slide.
Ms. Begonia, you may start on this
Thank
slide.
you. In addition to the school decision tree, we also have a COVID-19 scenario chart that we follow for staff. We also follow, this is a document that's published by the Ventura County Public Health, and it focuses on any positive cases or any suspect cases. It also tells us if we have a negative test or we have a positive test, what are the steps the district has to follow to ensure that the individual does quarantine or self-isolate. So these are charts that will be available on our website. If you'd like to return back and take a peek at them, you feel free to do that. Next slide.
This is how we will communicate COVID case information to you. If someone has been exposed to a confirmed positive COVID-19 case, a letter and phone call will be shared with the close contact persons and impacted families. The close contact persons will quarantine at home. A close contact is defined as a person who was within 6 feet of an infected person for a cumulative total of 15 minutes or more over a 24-hour period. A Connect Ed call will notify the entire school if a person tested positive at that location. Next slide, please. Standard communication will continue as we currently have it. You will be able to find information on our district website, through Q Parent Connect, through Canvas. We will notify people through a mass notification, email, text, and phone, through social media, Facebook and Twitter, and through school-specific communication, the typical ways you would get information from your school site. Next slide, please.
Mr. Miller's muted.
Hello and good evening. I'm Mr. Dana Miller, the Director of Facilities for our district. Facility cleaning and sanitation protocols. Classrooms and restrooms will be cleaned and disinfected daily after in-person instruction has been completed and the building is unoccupied. Trash receptacles will be emptied, sink areas will be cleaned, towels and soap dispensers will be checked and restocked as needed, spot sweeping and spot mopping, disinfect the room with an electrostatic sprayer using EPA registered solution During the day, touch points will be disinfected as practical or when an unsanitary condition has been reported. I'm ready for the next slide. Air quality or heating, ventilation, and air conditioning. We've maximized outside air ventilation to rooms by increasing the opening of the outside air intake dampers on the HVAC equipment to 100% of their available fresh air. Air filters have been upgraded to MERV 13, considered hospital grade. Purchased HEPA air purifiers for every classroom and office. Set our HVAC fans to run continuously to keep bringing in fresh air, and they will only heat and cool when the buildings are occupied.
In the area of special education, we would like to share a few factors that will be affecting the experience of your children as they return to school. Safety considerations for students with disabilities will include all of us adhering to guidelines that have previously been outlined to all of the staff. This would include both assessment and small group services. Deaf and hard of hearing will not be required to wear face coverings. However, shield will be required. Only those individuals who are aged 2 years or under or persons with a medical, mental health condition, or disability that prevents wearing a face covering are exempt. And we do have additional behavioral considerations that will support children that are challenged in this area. The next slide. In the area of individualized education programs, we have several procedures in place that will assure your safety. IEPs will occur in person upon request as long as the public health guidelines for social distancing can be followed. However, we will continue to have IEPs via Zoom. This will ensure the safety of staff and our families. IEP timelines will continue to be followed so that we are continuing to maintain compliance for special education purposes.
Good evening, Oxnard School District families. My name is Chris Ridge, and I'm Director of Pupil Services for the district. And I support within the area of social and emotional learning. And I would like to talk to you now about ways that parents can help their child within this difficult time we are now living through. It is very important that we pay close attention to our child's health and their symptoms and behaviors, thoughts and feelings. And if we notice concern, contact a professional, a behavioral health services provider, or a physician. Make sure that your child stays in contact with friends and families, even though we can't be together. It is still possible to talk on the phone and all kinds of other electronic ways. Listen carefully to your child for signs and symptoms of distress. Spend time together with your family, be together in enjoyable activities. Although you'll be honest with your child, it is important to restrict TV and social media use so as not to overwhelm. It's important to provide structure and routine within the day, so setting regular times throughout the day for activities such as dinner time and bedtime. Learn and model stress management skills for yourself. I'll talk more about that in a minute. And also support the involvement of your child in sports and physical activity. Next slide, please. There are things that children can do to keep themselves well during these difficult circumstances. Of course, we always want them following the safety practices of wearing a mask, washing hands, and practicing social distancing. It's important to take care of the body by eating well and exercising, getting enough sleep. And relaxation techniques such as mindfulness and breathing techniques can be very helpful for calming stress. Taking a break from stressful situations, which could be screen time. That's why it says limit screen time, because sometimes screen time can be the thing that is most stressful. Go outside, get some fresh air, and surround yourself with positive friends who will help you through difficult times. Next slide. Now, I would like to talk to you about you. What can adults do for themselves during these difficult times? I'm going to begin by reading you a list of 20 symptoms of stress and anxiety. Reflect upon yourself as I read through these. So here are some symptoms: becoming easily agitated or frustrated, overwhelmed, difficulty in relaxing or quieting the mind, feeling lonely or depressed, avoiding others, low energy, headaches, upset stomach, tense muscles, chest pain, insomnia, not sleeping well, nervousness and shaking, or having a clenched jaw, constant worrying, racing thoughts, forgetfulness, inability to focus, poor judgment, being pessimistic, or changes in appetite. Those are all signs and symptoms of distress. And so as I read those, if you found yourself associating with maybe 2, 3, 4, 5, you are definitely beginning to experience signs and symptoms of distress. Here's some things you can do, and I'll tell you more in a minute. First of all, don't ignore those thoughts and feelings. Be aware of the stress that you're experiencing. It does help to set a routine for yourself, just like with our children. In times of uncertainty, it's good to be able to count on things happening with certainty, such as routines. Keeping our focus upon what we can control, perhaps draw yourself a chart, and on one side write a list of the things you can't control, and on the other side write a list of the things that you can control. Limit that social media and TV intake in regards to the news and COVID coverage. Be gentle with yourself and everyone around you. We're all experiencing distress. Next slide, please. Create healthy habits. I hear about a lot of people being more physically active these days and going on diets that are more healthy. Try and get outside. Reach out to your friends and your support network. Stay connected. Find something to feel positive about or grateful about, and stay calm as best you can. Maybe take up meditation. Next slide. And if after doing all these things, if you or your family, your child needs help, we have help. For students, we have wonderful school counselors who can be accessed through the link that you see in front of you. It's also available on the district's webpage. It's also available through my department, Pupil Services, and on each of the school's web pages, there is a link for the school counselor, a very, very important support for your child. Families have a number of options. Some of them are listed here for you. And I would encourage you, if you are experiencing those signs and symptoms of distress, and after doing those things to help yourself that I've listed, and you're still having distress, please reach out. It's very common these days for many adults to feel these signs and symptoms, and I encourage you to take care of yourself so you can be the best you for your child. Remember, our children learn much from just watching us. Thank you, and take care of yourself.
A reminder about questions. If time permits, we will address questions at the end. You may enter questions into the Q&A over the course of the presentation. We will not call on raised hands. Please use the Q&A feature. We are taking notes and will work to create a list of frequently asked questions to be published at a later date. Next slide, please. When we do reopen, we will return in phases. The return to school will be staggered by grade level. Teachers will return before students, then special populations may return, and then preschool to 5th grade students will return, and 6th to 8th grade students will return last. We do not have exact dates at this time. Next slide, please.
Good evening, Oxnard School District families. My name is Anna DeGenna, and I am the Assistant Superintendent of Educational Services. I'm here to share with you a little bit about the instructional program and our plans as we move forward. As you may already know, we have sent out a parent survey for you. And we are sending this survey in order to make every effort possible to reach all families for a response. We would like to know parents' choices, whether they will be selecting a hybrid model or a blended learning model or a distance learning model, and I'll speak to those in just a moment. Depending on those models, teacher assignments will be determined after the parent surveys have been received. You are selecting the option that best meets your needs. So both options will be available, and you will be selecting the option that best meets your needs and the needs of your child. If you need to change after you have made a selection, we will ask you to connect with your child's principal and discuss with the school site so that we can make sure to do our best to accommodate your needs. Next slide, please.
Good evening. I'm Dr. Torres, the Assistant Superintendent of Human Resources, and I will be discussing staffing for reopening of schools. Staffing decisions cannot be made until we've received the majority of the parent surveys. So therefore, it is crucial that you go online. If you have not submitted your survey, that you complete the survey, or if you need assistance, you can contact the school and they can assist you. Staffing needs will be determined by the number of families that are wanting to either stay in distance learning or do blended learning. It is crucial to understand that we cannot guarantee that your child will stay with the same teacher, as teachers may be reassigned due to the staffing needs. Slide.
Correct.
So I want to take a moment to go over the different options that you will have as parents in making a selection for your child or for your children. The first option is to continue full distance learning. That is the same program that we currently have. We will continue that program for families that do not feel that coming back to school is in the best interest of their children. This program continues the current model that we have in place, and that consists of virtual instruction. You will meet with your teacher. You will have daily interaction with your teacher 5 days a week. The teachers will be providing first instruction as well as reinforcing assignments and activities to be completed at home. All of the materials, including the iPads and Wi-Fi, etc., will be provided for the families. Next slide, please. The distance learning schedules you are familiar with, as this is the same schedule that your children have been participating in so far. They are available online, and here's the link as to how you can access them. You'll notice that these schedules consist of both what we call synchronous, so that is live face-to-face instruction via Zoom, and asynchronous, which is connection with teachers, but the students are interacting through their Canvas classrooms or their Google classrooms. These schedules will continue to be the same as they currently are now. Next slide, please. The second option that we will have for families is the blended learning option. And the blended learning option is also often referred to as the hybrid. And this is a program where the students attend school two half days per week in person. And then 3 days a week, they will be through distance learning at home. The class sizes will be smaller class sizes, and classes have been set up to accommodate anywhere between 12 to 14 students in the classes. This provides an opportunity to have face-to-face or in-person instruction, but also provides the opportunity for socialization where your students get to see their classmates as well. During this type of program, because it is blended learning, there will also be opportunities while the students are working virtually for assignments to be reinforced and activities to be completed at home. Students will be divided into cohorts in order to ensure that we maintain the small class sizes, and those cohorts will be Cohort A and Cohort B. Cohort A will attend class Mondays and Tuesdays, and Cohort B will attend class Thursdays and Fridays. Wednesday will continue to be a virtual day for all students. Transportation at this time will not be provided for general education programs, and there will be more information about transportation in some of the following slides. Next slide, please. Here is a schedule of what a blended learning or hybrid program would look like. If our students are in Group A, that would be Cohort A, students would come to school in person, and they would have in-person classes from 9:30 to 12:30 on Monday and Tuesday. There will be dismissal, and the students will have a grab-and-go lunch. Teachers will have their lunch break, and then instruction will continue virtually in the afternoon between 1:30 and 3 o'clock. If the students are in Cohort B, on those days, the students will be at home, and they will begin by checking in with their teachers in the morning virtually through Zoom. They will connect with their teachers. The teachers will spend 20 to 30 minutes with them in the morning to get them started in their work for the day, and they will continue their online work from until about 12 o'clock. Again, they will have their lunch break, and in the afternoon, the teachers will connect with them asynchronously or through their Canvas classrooms or their Google Classrooms. On Wednesdays, the students will all be home. However, they will connect online with their teachers in the morning in order to get the day started and assignments provided and any information or clarifications necessary given. And then on Thursdays and Fridays, we will follow the same as we did Monday and Tuesday, but the groups will be reversed. A groups will be home, checking in with their teachers at 9 in the morning and following instruction till 12, whereas B groups will be in person at school from 9:30 to 12:30 and follow the same format. And that is our schedule both for TK5 and our schedule for middle school for grades 6 through 8 is below, and it follows a similar time between 9:30 and 12:30 for Cohort A, and for Cohort B, it will be at home on those days. For the middle schools, we have divided those times so that the students will be able to get all 6 periods. On Monday, they will get periods 1, 2, and 3, and on Tuesdays, they will get periods 4, 5, and 6. And the same will hold true on Thursday and Friday for the other cohort. Next slide, please.
Student wellness checks at home. We will be asking our families to take students' temperatures at home. Parents are required to screen at home their child before they come to school. If they have a temperature of over 99.5 degrees, or they showing any symptoms COVID-related, sore throat, cough, severe headaches, body aches, we ask that you keep your student home. The school has thermometers available for families, and we ask that you call to the school to report the absence. Next slide. Once again, masks will be required in accordance with the California Department of Public Health. We will be following their guidance. Staff and students will be required to wear a mask over their nose and mouth while waiting to enter campus at all times while at school, except when they're eating or drinking, while they're entering and exiting school grounds, waiting for the bus. And if your child has an exemption, we will require a doctor's note for those exemptions. Next slide.
Excuse me. Regarding meals and recess, breakfast will be served in the classroom with the no spill, low trash menu. Lunch will be served as a grab-and-go lunch bag as students leave campus. There is no recess, but there may be teacher-led outdoor activities. Next slide, please. For dismissal, there will be several exit points at each school depending on the site. Each school will let you know their plan for drop-off and pickup of students. Next slide, please. Transportation will be provided only for the following students. Students with an IEP in which transportation is a related service and who reside more than the level of service distance from their assigned school. Newcomers at all grade levels at Frank and Lemonwood that reside more than 1.5 miles from their assigned school, and McKinney-Vento and Foster students that reside more than 1.5 miles away from their assigned school. Next slide, please. There will be no sports or in-person co-curricular activities at this time. Clubs may meet virtually, and the after-school program will remain virtual with enrichment and homework help. Next slide, please.
At this time, we would like to take a moment to ask some of the most frequently asked questions that we have received. As we stated at the beginning, at the opening of this webinar, we will take all of your questions that have not yet been answered and provide responses for you in the near future. One of the questions, I'm going to go through these questions that have frequently been asked of us. Does each school have a plan for drop-off and pickup plan? Each school was asked to identify pickup areas and drop-off areas and provide maps. You will receive, prior to coming back, each of your schools will be sending you information that will have that detailed information. Included in that information, it will also provide additional information such as how students will enter campus, their classrooms, and different details in terms of how they will function during the school day. Can students keep the same teacher? As we indicated earlier, teacher assignment will determine after we receive responses from the parent survey. There is no way for us at this time to guarantee that students will keep the same teacher. It will depend on the program selected and how we have to restaff our classrooms. Next slide, please. If we choose to continue distance learning, we will lose our spot at our school. At this time, our plan is to ensure that all students maintain their spot at their school of attendance. So we will be working to accommodate whether you choose distance learning or the blended learning to accommodate so that when we do resume in person in our traditional schedules, you will still have your spot at your designated school. Will the district provide a face covering for my child? The district will have face coverings available for people who do not have them and for people who need them, both for students as well as for staff. Next slide, please. Those are the most frequently asked questions that we have. This is just a reminder for our middle school students. Tomorrow is our last day of school prior to the winter break, and it is a minimum day for our staff and for our students, and the schedule is slightly adjusted during this hybrid model. Is not significantly adjusted, but we want to make sure that you have this information so that if you are assisting your children in Zooming into their classes, you'll notice that there's been a slight change in the minutes of instruction. Next slide, please. And at this time, I will turn it over to our superintendent.
I am here. I think it will depend on the situation, and if it was determined that the whole entire family is a close contact, yes, meaning if they have been around the individuals more than 15 minutes in close contact, yes, they should most likely get tested.
During our hybrid or our blended learning model, because students are only in school from 9:30 to 12:30, we will not be having a nutrition break. We will continue to have our campus supervisors monitoring our campuses, and we will also ensure that at any time they're monitoring the restroom areas as well.
We don't have enough information to answer questions about vaccine.
Thank you, Dr. She. Thank you, team. As you can tell, the team tried to respond as many questions as possible as you were asking at them in the Q&A section. We promise and will follow up with the rest of the questions. As I was reading some of them, we can see the diverse perspective about returning and not returning to school. Again, we cannot tell you what to decide. We can provide you with the information, and we hope that you will consider what is the best for your child at this time. We will do our best to see if we can put the survey back. It will require some work, but if we are not able, you can go and reach out to the school and they will work with you so that you can provide your answers. So, but please, please, please connect with the school because your responses are very important for us to look at the data. Once again, in January, by the end of January, we hope and our goal is to have another session with more concrete information. As we return to school in January, we are returning to distance learning the way we are doing it right now. The entire month of January, we are coming through distance learning. All the process of returning back requires not just the planning about coming into the physical, but also it requires that the city of Oxnard, even though within the county, but the city of Oxnard has decreased the number of cases. One of the questions was related to why didn't we return to school before? The answer, and we have explained that before during our board meetings, the city of Oxnard, 3 of the zip codes of the city of Oxnard have the highest positivity rate in the Ventura County. And those 3 zip codes are exactly the ones that are surrounding the majority of our schools. So for that very reason, we were not able to request a waiver. We were not able to open. The county was in red because of the average of the entire county of Ventura with all the different districts. The city of Oxnard has been one of the cities with the highest impact with number of positive cases of COVID-19. And we have 3 zip codes that are above the 20%. So I just want you to know that it wasn't that we wanted, but we couldn't because of that. So we will continue providing you with more information. We do appreciate, we do appreciate the efforts that you're putting to supporting us, to supporting your child. Our teachers are doing an amazing job trying to keep up with this new way of doing the work and engaging with your child and trying to provide engaging and meaningful lessons. Absolutely. We know that it's not the same. We know that the time invested is not the same. We acknowledge that, and the teachers know that as well. The teachers also want to be in person with your kid. We also know that it is not safe right now. So thank you for understanding. And I want to thank each one of the members of the team that spoke today, because this team has been doing the work and has been engaging with the site level, with the principals, so that we can provide the best that we can to your child at this moment. So again, be safe. Please, please, please avoid those big gatherings, because the data shows that that's where the positivity rate increases. Have a wonderful holiday season. We will continue communicating with you, and we will continue doing our best to serve your child and to provide the highest quality education that your child deserves. Once again, thank you. Happy holidays.